morning, everyone. While talking to a friend about migraine, I was surprised to hear her symptoms. Her vision gets blurry, one side of her head starts hurting terribly, and she just starts losing focus. I was always under the impression that migraine was just a severe type of headache, but I never knew that there could be various types of migraine with such varied symptoms. Welcome to the latest episode of Wake Up to Health Talks. We have with us today Dr. Vishal Jodi, a leading neurologist from Ahmedabad with over a decade of experience in neurology, to tell us a little bit more about migraine. Welcome, doctor.
Thank you, ma'am, for the kind introduction.
So, sir, like me, I'm sure there are many of us who don't actually understand the complete difference between headaches and migraines. So, I wanted to ask you, what are the different types of migraines and how are they different from headaches?
Headache is a broad term which indicates that there is a pain in your head. But there are multiple types of headache which are primarily classified into a primary headache and a secondary headache. With a secondary headache, there is some cause, for example, either a sinus issues or because of any pressure in your brain, or is there a infection or blood clots, etc. And in primary headaches, you don't find any structural lesion in your brain, but you suffer from these headaches. And that includes migraine, cluster headache, tension type headache, etc. So migraine is one of the most common type of primary headache or headache in a whole, for which a patient seeks a medical consultation.
Okay.
And
so, sir, that's very well said. And, I think the triggers can also be very different for headaches and for migraines. I've heard even for different patients of migraines, their triggers might be different and they change from season to season, from environment to environment. So what are these triggers that can, cause you to have a migraine attack?
Migraine as such is a propensity to develop a certain type of reaction in your brain, which leads to excitation of the pain receptor pathway and vasodilatation. So every patient has their own set of triggers and propensity to certain things. For example, some patients have migraine on exposure to cold, but most patients have headaches on exposure to either heat or warmth, or even during cloudy seasons, atmosphere, or exposure to sunlight and sleep. But majority patients also have because of sleep deprivation, stress, anger issues, etc. Also, there are certain food triggers. Everybody has got their own different set of triggers. In food, the common triggers which patient may or may not have includes chocolate, cheese, coffee, vinegar, Chinese food items with the Chinese sauce, etc. Even deep fried foods can cause headache, and but it is not present in every patient. Some patients who develop headache with coffee, but few others will be there who will have benefit with coffee. So it is individualized. We cannot just give a blanket answer that these are the triggers. Also, there are other triggers where patient develop a headache after exposure to a certain type of smell. Even a strong perfume, either good smell or bad smell, can also lead to development of migraine headache. So it is quite variable and it varies to person to person. A person has to be vigilant to identify these triggers. And if there is a correlation which is noted regularly, then patient can say that this is causing my headache, and they can try the trigger avoidance therapy.
I actually didn't know that, small things such as food items can actually trigger a migraine attack. That's it's very important to stay vigilant and to, as you very well said, to understand and to, record the behavior that might actually lead to a migraine attack. So, sir, I was wondering, are there any symptoms of these? What kind of, physical symptoms that you might see that might help you identify that I might be going through a migraine attack and it's not just a headache?
The common migraine which we usually see has this typical headache which is throbbing. The patient will say that there is a throbbing headache, there is a pulsatile headache, which can be either on one side, which lead to the terminology adasisi or adusi, which we know in our vernacular language. But it is not always on the half of the side of the head. It can be even holocranial also. It can involve the full head. Okay. Also, during this period, patient will have a moderate or severe intensity pain, which should last for about 4 or more hours. And during this, patient will develop either a nausea or vomiting, or also patient develops photophobia and phonophobia, that they will have irritation to sound, especially loud and shrill voices with high pitch sounds, and to light also. That any patient will try to avoid the bright lights, and usually patient try to remain in a calm environment, avoid from any stimulus. So if patient is suffering from these type of symptoms, then we have to consider that the headache is likely to be a migraine. Now, other thing is migraine with aura. In such cases, patient's headache starts with few other sensory symptoms. And most common aura is a visual aura, where patient develops a scintillating scotoma, where the patient will see starry figures in the environment wherever he is trying to see, and they will gradually increase and decrease in size, and after that the headache starts. Some patients even feel sensory aura, where they develop one side paresthesia, the tingling sensation, and then the headache starts. Even rare cases are there where patient will develop weakness also with migraine. So there are multiple symptoms, but the most common are those which I described with common migraine: that headache, throbbing, nausea, vomiting, photophobia, and phonophobia. So if you are having this, you should consult a neurologist for identification and treatment of the migraine.
So this actually brings me to my next question. When I was talking to my friends, they all say that there are medications that can subside the symptoms, but that there are no remedies available, and you just have to wait it out. Is that true?
Migraine, as such, is a propensity to certain things, as we discussed previously while we were talking about triggers. It is how your brain is made. It is how it is structurally formed. So we cannot change the structure of brain. But what the drugs do, they will reduce the susceptibility and sensitivity to certain triggers. So the migraine has two type of treatments. One is acute treatment. These are painkillers which are available over the counter. And so what does patient do? That they will start taking these medications whenever they start developing headache. But they won't go for the prophylactic therapy. So what the problem is that this pills, this NSAIDs, these painkillers, they will help in reducing the pain in the single attack. They will not help you to reduce the incidence or the severity of the next attack.
Exactly.
So there comes the prophylactic treatment. These prophylactic treatments, there are multiple drugs which are helpful. They will reduce the severity, intensity, and your susceptibility to the next headache. So if you take that, then your frequency will reduce drastically, the severity will reduce, you will be able to tolerate the headache better, and the requirement of the acute treatment will reduce, and also the response to acute treatment will improve. So we cannot say that this prophylactic drug will remove migraine from your brain, but it will help to reduce the suffering. And usually we give it for about 6 to 8 months, and it depends from patient to patient. So if it reduced to such a low frequency that it occurs only about once a month, then we tend to reduce the prophylactic treatment gradually and we stop it. But as such, I told that it is a problem of brain which is going to stay. So if there are some undesirable circumstances, if there is stress, for example, traveling, or if patient has sleep deprivation, if patient is exposure to sunlight, etc., or any trigger, loud voice, a DJ, patient has went to a wedding where there is a DJ, loud sound, patient has woke up early, then this can again trigger migraine. But the frequency, if it is less, then they don't require again restarting of prophylactic treatment. They can take acute medication. But if the frequency is high, they will require prophylactic treatment. But we cannot eliminate it altogether.
Even though we can't eliminate it, as you said, these kind of treatments can actually reduce, the frequency to a very less amount, and it can actually enable you to lead a very normal life.
Improve quality of life.
Improve the quality of life, exactly. And I think the best judge there is a neurologist or your, physician or your doctor. It's very important to consult the doctor at the right time and not suffer through all of these symptoms. Thank you, Dr. Vishal Sogi. This brings me actually to my last question. I think none of my interviews are complete without a question of COVID-19. What we've seen in the past few months, everyone is holed up in their rooms, in their homes, and they're interacting with each other and they're working from home. through their virtual screens, through their computer screens. And I've heard that these might be very acute triggers for migraines. So can you suggest some basic tips that one should remember while working from home and while interacting with their loved ones on their screens, so that they do not become a victim of migraine?
See, now this is a new normal, and we have to get adjusted to it. But there are a few tips which we tell our patients who are suffering from migraine, that you should keep the brightness of the screen to lowest possible. And also you have to keep the room well lit, because if a room is dark, then there will be a fluctuation in your eyes, the light in your eyes, and it may even trigger the migraine. And you try to use the matte screen. If you are using a laptop or tablet, then try to use matte screen, laptop anti-glare screen. And also, if you are using your phone, then it is preferable that you start the blue light filter, and also apply a matte screen guard. So this will help in reducing the glare and reduce the propensity to develop migraine. Also, while working at home, many a times, because they are at home, they will work late at night, and this may also contribute to the headache. So they should always keep that this time in their mind, and then they should maintain a sleep hygiene, normal sleep hygiene. Because what they tend to do at home, that they will start working till 2 and they will sleep till late, and this will again, because of this altered sleep-wake cycle, they will again develop increased propensity to headache. So these all things should be taken care of during this COVID pandemic and work from home scenarios.
Thank you, Dr. Vishal. These are excellent tips. I think I myself should implement that. I use my phone without the blue light filter. Implementing these small tips in our daily lives can actually, even if you're not suffering from migraine, these can be very good for your health, for your eye, and for your brain health. Thank you, Dr. Vishal Jogi, for this interest.
Thank you, ma'am. Thank you.
I am more aware about migraine as a neurological challenge. And I'm sure my viewers are also they can understand migraine more now. Thank you, Vishal Jogi, for joining us today. Thank you, viewers, for joining us. And we'll see you in the next episode of Wake Up to Health Talk.